Okay, I'm joined today by Dr. Dennis Hermesch from Novartis Animal Health. Welcome to the program.
Well, thank you, Walt.
Dr. Hermesch, tell us a little bit about your responsibilities with Novartis Animal Health, areas of the country that you cover, and some of the topic areas you discuss with producers.
Well, yeah, Walt, I've been with Novartis now for just 3 years. I practiced in Nebraska for 24 years previous to that, and my responsibilities is just like my title says, professional services. I do everything from assist salesmen to troubleshoot to do meetings when the veterinarians want to invite producers in.
Appreciate you joining the program today. I want to discuss with you a little bit about BVD and tell our readers about BVD in general and some of the reasons why it causes concern in dairy herds.
Well, most dairymen are very aware of BVD. There's plenty of articles in it on almost any magazine you pick up. Well, is all this hype justified? I think so. And the reasons are, there's really three main reasons I think that BVD needs to be a major consideration of a dairyman. Number one is it's very difficult to control. It consists of hundreds of different viral strains, and it's difficult to diagnose and very hard to control. Number two, BVD causes many different problems. From respiratory problems to abortions, BVD is a very immune-suppressing virus, and on much of its economic impact in the dairy is a result of weakening the immune system. This leads to secondary infections from other pathogens floating around the animals. The virus is often a precursor to Pasteurella pneumonias, Mannheimia pneumonias, even the Haemophilus. The number three reason I think BVD needs to be a consideration is it's so prevalent. Is it a risk to your herd? Researchers say that up to 85% of all cattle are exposed to the virus. So yes, it's very common, causes a lot of different problems, and it's hard to control. So if you summarize those three things and take them into consideration, BVD should probably be the number one disease that we design our vaccination program around. The immune suppression of BVD can be major in a dairy. Just think of all the diseases that might surface in the dairy if you had something similar to AIDS floating around suppressing the immune system. BVD can be from a mild to a severe immune suppression. The mildest infection may wipe out 20% of the immune system, allowing all the secondary infections to invade. But a severe BVD infection may wipe out 80% of the immune system and actually kill the animal itself, just the virus. The immune suppression allows all kinds of secondary bacterial infections, your Pasteurella, Mannheimia, Haemophilus. In my practice experience, I found that if I really got BVD under control, many other secondary infections were less of a problem, even Salmonella.
It sounds like there's a wide range of the impact of this herd health challenge. Tell me a little bit about why you think producers should pay attention to it, and how do they get their hands around how difficult of a challenge it is on their particular herd?
In my opinion, the majority of BVD is subclinical. This slide illustrates the importance of controlling the subclinical BVD. It's almost like the clinical cases are just the tip of the iceberg. We know from the previous slide that most cattle are exposed to BVD, and we know that PIs are getting harder and harder to find, yet BVD is not disappearing. How does the virus perpetuate itself? Does it pass subclinically from cow to cow like the common cold or the flu does in people? I don't want to downplay too much the importance of PIs. PIs are a problem, but maybe through marketing and promotion we have come to think that PIs are the whole problem. Through testing and elimination, we've reduced the PI incidence to an extremely low percentage, yet we still have BVD. The subclinical infection may cause PIs. The PIs may perpetuate the subclinical infection. Either way, so which came first, the chicken or the egg?
When I first heard this presentation was going to be given at an industry event, I was really interested in the title of it, Biotypes and Prevention. Tell me how biotypes you think help answer this question about how the disease is passed from cattle to cattle.
Well, the biotypes may be one of the biggest reasons BVD is so hard to control. The nature of the BVD virus makes it very adaptable, leading to hundreds of variants falling into all kinds of classifications. We know that the more similar a disease virus is to the vaccine virus, the better protection, because immune response will recognize the infection quicker. This is why the vaccine to the common cold virus is so difficult to get. There's too many cold virus strains. We can't get one close enough to the field strain. Many dairymen have heard about type 1 and type 2 BVD, but are far less familiar with the biotypes, cytopathic, CP, and non-cytopathic, NCP. CP and NCP have no gray area. They're scientifically classified into either CP, which is not real common in the field, or the NCP strain. strain, which causes most problems in the field. In fact, all PIs are caused by the NCP strain, and over 90% of all strains of BVD diagnosed in laboratories are the NCP strain. BVD strains really aren't created equal. If we recognize the two biotypes of BVD, we know that all BVD viruses are divided into the NCP or the CP strain. The NCP has been found to be the most damaging. It's a major isolate from all clinical BVDs. It's the biotype that causes PICAS and thus keeps BVD circulating in the field. So is BVD biotype really that important? Well, consider these factors. The NCP-BVD is a major cause of bovine abortion. The NCP-BVD causes all PIs. The NCP-BVD is a major clinical isolate from all BVD outbreaks. Over 90% of all lab isolates are the NCP strain. And yet the NCP-BVD vaccine induces stronger humoral and CMI immune responses.
Appreciate that recap, Doctor. Tell me about what some of the suggestions would be to incorporate this knowledge about BVD biotype into an actual herd health program or a vaccination protocol.
Well, that may be one key to the control of BVD, is as I stated earlier, the more like the disease the vaccine is, the easier it is for the immune system to recognize the disease and get it under control. So by incorporating NCP strain into the vaccination protocol, the NCP immune response is probably going to be more similar to the infection that's trying to get into the animal. So to summarize a little bit on BVD, BVD is one of the hardest diseases to control, yet may be the most significant threat to your cattle operation. The NCP strain is the most prevalent in the field. The NCP vaccine induces stronger and more complete immune responses. So you might consider rotating a 4-ray viral vaccines to better obtain BVD immune recognition and include the NCP strain. So a producer may talk to his veterinarian to ensure that the vaccine protocol provides coverage for the BVD NCP strain.
Thank you for your discussion today, Dr. Hermesch. We appreciate your time today.
Thank you very much.